This is Karen with NewClevelandRadio.net, and it is time for Care Notes for Caregivers from Cherished Companions with Doug Wilbur. And Doug Wilbur has some guests today. Welcome.
Well, thank you, Karen. And I have a very special guest today on our show, and want to take the opportunity to let our staff know that we've had some significant changes this last year in a good way, and that we've added some staff that I believe are going to be critical not only for what we do day to day, but also for as we grow into the future and some of the challenges that are occurring with care in the home, making sure that we're doing it right. One of the positions that we added was that of a staff nurse who is involved, or essentially a manager of home care nursing that we hired on, and her name is Molly Patel. Molly Patel has actually worked for us for a while in a consulting role, and then we've pulled her on to do the day-to-day work in-house to really be a support for our staff in the field and for designing programs and designing other things as well. So with that, I'd like to introduce Molly and welcome to the show. And Molly's going to tell us a little bit about her.
Hello, everybody. So my name is Molly. I've been on staff here at Cherished Companions for about 3 months, and before that time, I consulted for Cherished Companions on a case-by-case basis for probably the last 6 years. Normally, the things that kept me busy were the most complicated patients that we were caring for. And believe it or not, there are a lot of patients in home care that have multiple chronic conditions that sometimes need the eye of a nurse or some coordination. So that's kind of what I've been doing. And I'm very happy to be on staff. Before I did home care, I spent pretty much a lifetime doing intensive care nursing at the Cleveland Clinic. I was a charge nurse there in one of their intensive care units, and saw lots of things, almost everything under the sun, you might say. I also was a CPR instructor and an ACLS instructor for them, and I was on the skincare team, monitoring pressure ulcers and trying to prevent pressure ulcers from forming, and then working to treat the pressure ulcers that people would develop to get those healed. So that was a big part of what I did too. Doug Wilbur has brought me on staff really to be a support to all of you caregivers out in the field. I know that when you're out in the field in someone's home, it can feel rather isolating, and there are times when you feel like you just need an extra little bit of support, someone to call and ask questions of, or even to come see your client if there's a change in condition. So that's what I'm here for. And sometimes, there's perplexing problems that pop up while you're caring for somebody. A lot of our clients will have, for instance, diabetes, COPD, which is a breathing problem, along with a heart condition. And if they have a change in condition, their level of consciousness would kind of get diminished, or they start having more breathing problems, or they spike a temperature. I'm here to support you. So feel free to call me and have me come out and see your patient. I've also come out to clients' homes to help just brush up on skills with people, like how do you use a Hoyer in somebody's home. I've taught a couple of people how to use a Hoyer lift, and how do you take care of somebody who's immobile and try to prevent pressure ulcers. So I can come out to the home and help coach you with that. And I've done a lot of coaching with the families as well. So anyway, so some of the things you might see while you're taking care of your client, you might want to give me a call for, and I'm happy to come out and like make a plan of care for that patient, and even to call the doctor and develop a plan of care with the doctor as well. If a patient suddenly gets more confused than they normally are, it's a good idea to have me come take a look at them. There might be a problem with a urinary tract infection, or it might be a change in medication or a need for change in medication with them. And it could be some other kind of infection going on, or some other condition that's caused them more confusion. So I'm happy to come out and take a look at that. And some people, they might get a skin tear, have a sudden rash, or have problems with rashes, with incontinence or something like that. I can help develop plans for that. And I also have got a lot of good products that we've used to help heal those things up. So I'm happy to try to find the products that would help your client and make things as ideal as possible. Also, some of our clients are hospice clients, or they're in the process of passing on. And for some of our caregivers, that's a really new experience to walk through that process of hospice care with this clients. If that's the case for you, I can come out and assess your client. I can give you some tips on how to walk through that with your client and their family. It can be a very emotional time, and also there can be, special things that we can do for care for that person, because their care needs change a little bit. The focus of their care changes a little bit. I also can come out and do medication assessment to see if there's appropriate medications that your patient is taking, if there's any interactions with any of those medications, because there are times when a person is seeing several doctors at the same time. They might have a couple of different specialists, and then they have a primary care doctor, and the communication between all of those doctors is not always ideal. And so some doctors may not know all of the medication that another doctor has ordered, and then people can run into interactions that way. So I have done medication reviews with some of our clients and consulted with the doctors and gotten things adjusted so that they're on a better regimen for their medications. And also, one of the other challenges we face in home care is transferring issues. If a client is more difficult to transfer from bed to chair or chair to shower, that sort of thing, we have some tips that might be able to help with that. Or if you see, a change in your client's condition, please do call me, and I will make it a priority to come out and see your client. Vomiting, diarrhea, constipation, if there's change in consistency with their urine, signs of infections, or a fever. if they're having shortness of breath or difficulty breathing, or sudden weakness, you know, or an increase in their pain or in their confusion. This is, you know, certainly not an inclusive list. There are lots of things that can happen with our clients, but I'm happy to try to find the answers for you that you need, and to be here as a support and just a phone call away, really. So, you know, feel free to call me at the office. I'm Molly the nurse. Everybody knows who I am. I'm the only nurse here. So if you give your CCM a call and ask your CCM to get in touch with me, they can quickly get in touch with me. And I can help triage these things that you're dealing with your client, see what's urgent, or if something needs immediate attention, or if it's something that can be, you know, have a conversation with the doctor about, and I can help you with that. So I really look forward to meeting you when I come do my rounds and assess our patients. And I hope that I can be helpful and just a touch point of support for you in the future. Okay.
Well, and I'll just kind of finish up by saying how wonderful it is to have someone with the talent that Molly has. And Molly can be pretty humble as far as things that she's accomplished, but I will say she is an extremely accomplished nurse, and for us to have her on board is quite the coup on our part. You know, number one, and the second thing is that she really has a servant's heart, which is great, because what she wants to do is help you out in the field do the things that you do every day and not feel alone and not feel like there aren't answers. We are here to support our staff in the field, and to have Molly on board is just an amazing way that we have to be able to support you in the work that you're doing every day out in the field. And it's simply a phone call away, or letting your client care manager know that you're having some struggles or issues or are worried about something. And Molly is here, ready, willing, and able. So I wanted to thank everyone for listening to our podcast today, and look forward to hearing all the good stories about the wonderful things that Molly's been able to do for everyone. So thanks, everyone.
Today's theme was Nurse on Staff. Thanks for joining us for Care Notes.